Yes, good evening, ladies and gentlemen. Welcome to another episode of Busting the Myth. Today, we will not be busting any myth, but rather, we'll be talking on something very important, something that most persons don't know it exists. We call it sudden infant death syndrome. Yes, it is real, it happened. People have lost their children, their child rather, a child that was healthy, a child that was not sick throughout the day, a child that fed well, that played, and suddenly the child dies the next morning. While you wake up, the child dies. This is sudden infant death. You take the, in fact, investigation will be done. Nothing tangible will be found that has killed this child. You cannot find anything. Autopsy will come out to be clean. It is known as sudden infant death. Any death that occurs in a child between 0 months to 12 months, and the cause of death is unknown even after a series of investigation and autopsy, this is known as sudden infant death. In fact, research has shown that sudden infant death can occur between, it has a ratio of, it causes 1.7% of all the deaths that infant mortality death that occurs. So sudden infant death takes about 1.7%. Of course, in Nigeria, sudden infant mortality is on the very high. We have about 74 deaths in every 1,000 live births. So it is very high in Nigeria. So if, for example, a child is healthy, a child is not sick, a child fed well, he feeds well, he sucks well, that doesn't mean that the risk of sudden infant death has been eliminated. So even though your child is healthy, these are what you need to watch out that can cause sudden infant death in your child. One, sleeping position. Some of you are from the habit that because the fact that your baby, get sleep well when you turn him, he sleeps with his face facing down, means that it is not risky. So sleeping position of your child matters a lot. For example, you sleep, you place your child in lying with his side. It's also risky. Lie your child with his back. Don't turn your child. Don't put your child in a prone position. This position can predispose your child to what? Sudden infant death. Another risk that can cause sudden infant death, your child that has been healthy and suddenly dies in his sleep, is you cover his face. Some of you have always do this thing. You place your child is sleeping, you bring duvet and you cover the child. It can predispose your child. Or you cover a child because there is cold. This can cause sudden infant death. Another risk factor that can predispose your child to sudden infant death is what? You wrap your child. Yes, one of the causes of sudden infant death is when you expose your child to extremes of temperature. For example, in places that is very hot, you expose your child to hot temperature. It can predispose your child to sudden infant death. And you expose your child to extreme cold too. It can predispose your child to sudden infant death. So maintain balance. If it is hot, make sure your child is not exposed to hot. In fact, it is necessary for you, if you have the financial capability, to have what? AC or fan in your room. Not just leave your room, it's hot. Have AC or fan in your room. Some persons believe that cold, when you expose your child to AC or fan, it can cause them pneumonia. This is not the cause of pneumonia at all. This is a myth. We're going to talk about it maybe later on when we start talking more on pediatric cases. So exposing your child to cold will not actually cause your child pneumonia, but there are other problems, for example, allergy and others that can predict, but not pneumonia. So that is that. Then another cause of that can predispose your child to sudden infant death include what? Pillow use. Your child is just 6 months, you are teaching him how to use pillow. Why? Let him sleep. Pillow will disrupt his sleep. Don't use pillowcase. Don't use pillow. Let them sleep like that. Position of sleep matters. Don't allow them to use pillowcase. Don't cover them up extremely. And when it is cold, cover them. When it is hot, expose them so that they will get, you know, they will get exposed to fresh air. Another cause of sudden infant death is what? Maternal sharing of bed. Maternal sharing of bed. You give birth to your baby because your baby, you feel that you want to always breastfeed your baby throughout the night. You want your baby to get breast milk throughout the night. You want your baby to, you just always want your baby to be close to you. You want to always pamper your baby, and hence you share bed with your baby. It is one of the risk factors that can predispose your child to sudden infant death. It's one of the risk factors that can predispose him to sudden infant death. Your child may die in sleep. What you need to do is, even though you don't have a room for your own child, yes, they should stay in your own room. Get a baby couch, a baby cot. You place your child there. The baby cot, the characteristics of a baby cot that will not predispose your child to sudden infant death is that baby cot should not have teddy bears, that can fall on your baby and suffocate your baby. 2, that baby couch, the mattress should not be soft, should not be very soft, just be good mattress. We know when we say soft mattress can kill your baby. The mattress should be at least hard a little. 3, when your baby is going to sleep, don't cover your baby. Everywhere is hot, you want to cover your baby. Wear the baby light clothes. Some persons, even when everywhere is hot, they will tell you, cover this baby. You wear woolen clothes for this baby in hot environment. You give the baby cap as if the baby is in Russia. You give the baby thick clothes. This can predispose your child to sudden infant death. Regulate what your baby wear with what the temperature you have. Don't mind them. People will say, don't mind this baby. The baby is sweating. Don't mind, it's fake. It's not true. The body regulatory mechanism is not fake. The body regulatory mechanism acts according to what the environment is giving it. If your environment is hot, mechanisms that will cool your baby will put into place, such as sweating, that will cool your baby. If everywhere is cool, mechanism that will make your baby uncomfortable will be seen. For example, the baby will always be crying because it's cold. It's cold. If it is a very fair boy, a fair child, the baby is very light in complaint, you see his face will become reddened because it's cold. So all these mechanisms are not lies. The physiological mechanisms are never lies. They respond according to what the environment is giving them. So if your baby is extremely cold, cover your baby, but don't cover the face. Cover your baby, but don't cover the face. Give him woolly clothes. But if it is hot, for example, you are in Nigeria, give your baby light clothes to wear. The issue of fan will cause pneumonia, or AC will cause pneumonia is not true. It is totally false and totally wrong. If you know your house needs AC, even though you have a newborn baby, give your child AC, but regulate it to be room temperature. It helps the baby also. Okay, another risk that can predispose your child to sudden infant death include what? Smoking. Yes, this is very important. But doctor, I don't smoke. There's what we call active smokers and passive smokers. You may not be smoking, but your husband is smoking. You may not be smoking, but you work in an environment that they smoke. You have become a passive smoker. You smoke indirectly. You smoke. Yes, you smoke. You have become a passive smoker. So if you are pregnant and you are a passive smoker, your child, when you give birth to that child, has a risk of have a risk of sudden infant death syndrome. Or when your husband is smoking, you sit on his lap, you rub his head, baby, I love you, darling, I love you, discuss, and you are exposed to cigarettes while you are pregnant. It is one of the risk factors of what? Sudden death syndrome in children. So another risk factor include what? Premature death and premature birth. We are going to see the reasons why a mother will have premature labor soon, and we're going to see the reasons why a mother will have a child with low birth weight. If you have not subscribed to my YouTube channel, please kindly subscribe to my YouTube channel so that by the time the videos are rolling out, you can also be abreast of what we are discussing. So we're going to discuss even how to manage home management of diarrhea. We're going to discuss the myths surrounding diarrhea, and then the myths regarding why your diarrhea will continue to be worsening. Your child diarrhea will continue to worsen even while you are giving this child antibiotics. You're doing all what you need to do that will stop the diarrhea, but the diarrhea keeps increasing. We're going to see all this. There are little tricks that will save your child and save you lots of money. So premature birth, low birth weight, there are also risk factors that can predispose your child to what? Sudden infant death. So from what we have discussed now, take note that sudden infant death is death that occurs between 0 months to 12 months in a child that was assumed well, in a child that has no that was well, and then when they went to bed, they die in their sleep. And when autopsy or all investigations were done, it comes out normal. Some persons will think that somebody have killed their child, or maybe one witch has killed their child, or one person, they believe that one person from the village people have gotten close to them and has killed their child. Nothing like that. You predispose your child to risk factors that can cause sudden infant death, and it happened. So 1, sleeping position of your baby matters a lot. 2, bed sharing, when you share your bed with your baby. 3, you cover their face. 4, the mattress of the baby is extremely soft. You cover your baby's face with wrapper, and all what you do, you wrap your baby like shawarma. All this can predispose your child to sudden infant death. 5, maternal smoking. Not just maternal smoking, but you are predisposed to, you stay with people who smoke, so hence you become a passive smoker. You are exposed to nicotine. Nicotine is one of the risk factors that can predispose your child to sudden infant death. 5, exposure to extreme environment. If your room is hot, put on the fan. But however, if don't expose that child to raw directly, even you exposing you to direct breeze of fan, you will not like it. Control it, make it to be very moderate. Air condition, your baby will enjoy air condition. There's no problem, to not cause him any problem. Then 6, delayed prenatal care. In fact, those of you that have decided not to you just got pregnant and just got married, you are looking for a child the next day, you got married today first, you are looking for baby second. If you have not gotten pregnant within the 3 months, you start crying, infertility. Why are we disturbing ourselves, for crying out loud? In fact, it is very important, if you want to have healthy, good baby, it is very important for you to plan your pregnancy. You know that your marriage is this month. At least before this month, at least 4 months before that, your marriage plan, you start seeing your doctor, you do preconceptional care. Preconceptional care is very, very important. This particular generation of us, most persons get away with so many shits they did long ago, but this our generation, so many things have cropped up. We are exposed to so many things that need to be checked. If not, you start giving birth to children that will give you problems, that will make you spend hell of money. So it is good you do preconceptional care before you get pregnant. Then prenatal care also, antenatal care. You need to take care of your antenatal, you follow your antenatal processes. When you give birth, you always take your child to your doctor appointments, so that if there's any problem, even though your baby seems not to be sick, but still go to doctor will come greet you. There's a way you get close to your doctor. Baby, your baby is fine. Your doctor will look at your baby, and if there's anything, your doctor will be the first to tell you. You might not even notice, but your doctor will notice that something is wrong with this baby. So try and get close to your doctor, and if there's any need be, your doctor will take care of your baby, and if there's any problem, your doctor will point it out that there's a problem, and he will solve your problem. So thank you so much. This is the end of our discussion of sudden infant death. So please take care of yourself until we meet again in our next video. Thank you so much. Have a wonderful night rest. I remain Dr. Lawal Abdul Salam, your host on Busting the Myth. Thank you so much. Bye bye.